What to do first if you have tested positive for COVID-19? Is it necessary to take the antibiotics, do the X-ray or CT scans or not? These are main questions that worry patients. The first advice from doctors is don't panic. How to act in case of infection, our correspondent found out.
More than 16,000 cases of COVID-19 in Ukraine. This is the latest data. 2,069 people have been hospitalized. Over the year, the coronavirus theme has given rise to a plethora of myths and fakes, and this seriously affects the work of doctors who are fighting the pandemic. I urge you to use only verified information that comes from the Ministry of Health. The virus is not as bad as the pressure on healthcare system, Olga Holubovska, an infectious disease specialist, says.
Coronaviruses are very dangerous, especially coronaviruses that are circulating at the moment. There are 3 coronaviruses that have put the greatest strain on the healthcare system. They need instructions if suddenly something happens at night.
Olena confirms that the workload has increased significantly. She's a family doctor and is in touch with patients 24 hours, 7 days a week. She says that most of them have a mild form of the disease.
8 months have passed. Everyone was the most scared at the beginning. No one knew what to do. Well, now you understand that you have to be both a doctor and a psychologist and an advisor to calm down your patient.
Don't panic. This is perhaps the very first advice for the patient. If you think that you've contracted COVID-19, you shouldn't rush to the hospital, because there is a risk of spreading the virus, doctors say. Better make a call first and self-isolate until the diagnosis is confirmed.
If you do not have the opportunity to leave the apartment and live separately, then it is better to isolate yourself in a separate room. At the same time, hygiene is very important, as well as wet cleaning, and while staying at home, it is obligatory to wear a face mask.
If your COVID-19 diagnosis is confirmed, do not hurry to do a computer tomography. Mind that this is a large dose of radiation. It is used to see how badly the lungs are affected, doctors say.
Just count how many breaths you make in 1 minute. What is your heart rate? You can do all this at home, calmly.
Antibiotics are not a weapon against the coronavirus as well. They don't eliminate the infection but fight the consequences of the disease. The main advice of doctors is to wear face masks, keep a distance, and be sure to choose a family doctor. He is the main person in the algorithm of your actions in case of coronavirus infection. Reported by Vadim Kramer, Inna Mazurkevich, UATV News.